Live.
Good afternoon. I'm Sheila Malcolmson, British Columbia's Minister of Mental Health and Addictions. I'm joining you from the traditional territory of the Songhees and Esquimalt First Nations. And along with thousands of family and friends who've lost loved ones during British Columbia's toxic drug poisoning crisis, I grieve the many, many lives lost during the overdose emergency. I'm here today with Dr. Bonnie Henry, Provincial Health Officer, Lisa Lapointe, British Columbia's Chief Coroner, Mike Knott, an activist with lived experience, and Senator Larry Campbell. We are here today to mark British Columbia's next step on preventing toxic drug deaths. Despite our government investing in addiction treatment and prevention at an unprecedented level, for example, over 100 adult treatment beds opened this year. We've doubled the number of overdose prevention sites and supervised consumption sites since 2017. Our First in Canada Prescribed Safer Supply program has had a 475% increase in take-up. We've shipped 1 million naloxone kits. Just this Friday, just days ago, we opened the 105-bed Redfish Healing Center on the former Riverview lands. It's for the treatment of complex, concurrent mental health and addictions. Despite this and more, we have lost thousands of lives. The expansion of services is historic. We've never asked our public healthcare system to do more, fighting 2 public health emergencies, rolling out an unprecedented vaccination campaign, and working hard every day to save lives. People on the front line, social service organizations, non-governmental organizations, peer workers have acted heroically to save lives. And yet, tragically, we continue to lose lives at terrible levels. Some days, especially after the effects of the pandemic and pandemic-related measures, increasing drug toxicity and exacerbating the overdose crisis. As the coroner has noted, some days we are losing 6 people a day to toxic drugs. Even though we're adding so many services, we continue to see so many deaths. Despite all this innovation and all this determination, we have not ended the public health emergency. And so we must do more. And today represents the next step for British Columbia in tackling British Columbia's overdose emergency. Once again, we are taking up a toll that no province in Canada has. Today, we applied for an exemption to Health Canada under Section 56 of the Controlled Drugs and Substances Act to remove criminal penalties for people who are in possession of small amounts of illicit substances. Substance use and addictions is a public health issue. It is not a criminal justice issue. By decriminalizing people who are in possession of a small amount of drugs, we will be removing a barrier to health and treatment services. I hear that shame and fear keeps people from accessing life-saving services and treatments, and shame and fear can make people hide their drug use and use drugs alone, and especially at a time of terribly toxic supply. Using alone can mean dying alone. As the coroner has noted, people are dying alone in their homes, often with their family and friends, having no idea that they were struggling with addictions. And that's why today's application is crucial. A dedicated and thoughtful group of stakeholders and partners helped build our application to Health Canada, including health and social service organizations, Indigenous organizations, people with lived and living experience, municipalities, law enforcement, advocacy organizations, and clinical and research groups. Together, we look forward to Health Canada's response and to working with the new Federal Minister for Mental Health and Addictions on an urgent basis. As we proceed with next steps, we will continue to work with our local partners throughout the province to make sure decriminalization is done right. Meanwhile, British Columbia will continue to build new treatment and recovery services and fixing a deeply fragmented system that was neglected for 16 years. While we pursue decriminalization, we are also tackling the toxic drug emergency crisis on all fronts. We're continuing to add overdose prevention sites, including for inhalation. We've announced the next phase of prescribed safe supply, expanding access across British Columbia. New access points, but also new medications. We will keep expanding our medication-assisted treatment program, including using nurse prescribers who continue to enroll. Again, a first in Canada option. Ordinarily, nurses can't prescribe anything, but they can prescribe medication-assisted treatment in British Columbia. And last month, we announced $132 million to invest in addictions treatment and recovery across the continuum, and filling gaps in the continuum of substance use care, including 195 new substance use treatment beds for adults. This is on top of doubling youth treatment beds, which is already underway. We're working every day to help people stay safe and access the supports that they need. There is more to do, and we need to use every tool in our toolbox. There is no magic bullet to end the drug poisoning crisis, but decriminalizing people who use drugs is essential to stemming the tide of the toxic drug crisis. It's essential to removing the stigma around drug use, which is itself vital to ending overdose deaths, and to building a more comprehensive system of mental health and addictions care for British Columbians. Thank you. I'm now going to introduce British Columbia's Provincial Health Officer, Dr. Bonnie Henry.
Thank you very much, and good afternoon. In April of 2019, the third year of the public health emergency that was declared around the toxic drug death crises, my office released a special report titled Stopping the Harm, Decriminalization of People Who Use Drugs in BC. In the report, I called upon both the provincial and federal governments to take a harm reduction approach to the toxic drug crises and to work towards this one piece as part of our program to decriminalize people who use drugs. And I am incredibly pleased to be here today to support the efforts of the government here in British Columbia to secure an exemption from Health Canada and move closer to decriminalization in our province. It has never been more urgent than now. With the COVID pandemic causing the devastation that we have been seeing in the past 20 months, this toxic drug crisis is not a criminal issue. It is not a moral issue. It is a public health issue, and it's one that we need to take many actions to address. And decriminalization of people who use drugs is one important one. Decriminalization helps reduce that stigma surrounding people who use drugs and their families. It creates the personal, social, instructional stigma that is associated with using drugs, creates serious barriers for people who would like to access harm reduction services and treatment programs. And the criminal charges for possession leads to a revolving door that we see of conditions that people who use drugs cannot meet. And that is part of our criminal justice system that takes up resources and stigmatizes people. Together, we can take this fear and shame away, and we can help keep people alive, and when they're ready, connect them to the resources that they need. Everybody's journey to recovery is different, and we need to have many tools to be able to support people. The time to make this change is now, and I'm very pleased that we have taken this step and that the government of British Columbia has done this. This approach as well will level the playing field across the province so that it is not piecemeal, it's not just one municipality, it is all of us working together. And we need only look to the 2,800 people who have lost their lives. These are our friends, our family, our brothers and sisters, to the toxic drug use since the COVID-19 pandemic began, to understand why this is an important step now. We have done well to collaborate amongst provincial, municipal, and federal partners, but it is only a start. And submitting this application now is our commitment to working with our partners in public safety, many of whom I've talked to in the last number of weeks, our partners at the First Nations Health Authority and in Indigenous communities across this province who we know are differentially affected by this crisis as well. It is a commitment to a beginning and a process that we will walk through together in the coming months and years. It is not perfect, and there's much more consultation that is needed, and we are committing to that today, and my office will be part of those consultation processes, and I commit to all of our public health programs being part of this process too. This is a reality that the very lives of our family, friends, and colleagues across the province depend on us working together to get this piece of our puzzle together to support people in British Columbia. I'd now like to introduce Lisa Lapointe, our Chief Coroner.
Thank you, Dr. Henry. Good afternoon. I'd like to extend my thanks to Minister Malcolmson for the invitation to participate today. I'm honored to be speaking on this very important topic with Senator Campbell, Dr. Henry, and Mike Knott on the homelands of the Esquimalt and Songhees First Nations. The Lekwungen people have been wise stewards of these beautiful territories for centuries. Senator Campbell was BC's chief coroner from 1996 to 2001, and his heroic efforts in support of a compassionate approach to those using substances have been inspirational to me and to many, many others. Thousands of families in our province have experienced the heart-wrenching loss of a loved one due to toxic illicit drugs. Those who died represent all ages, levels of education, walks of life, and geographic communities. From the work of our colleagues at the First Nations Health Authority, we know that due to the continuing impacts of colonization, including residential schools and intergenerational trauma, First Nations people have been impacted to a devastating degree. Many of those who died in BC had been experiencing the challenges of significant problematic substance use for years. Others had been using drugs on a regular or irregular basis while pursuing educational opportunities, maintaining careers, and/or raising families. Others had been abstinent from drug use for years, weeks, or months. Often substance use was a means of coping with significant challenges and traumas, often not understood by or visible to others. Criminalizing people using drugs has meant punishing those who are already suffering. It has meant layering fear, shame, and stigma onto those who are already vulnerable. It has meant separating good people from their families, their jobs, and their communities. It has meant removing dignity. There will be some who will oppose decriminalization of drugs at any level. Others will argue for much lower threshold amounts. Change can inspire fear and anxiety, and changing hearts and minds may take time. But we know for a fact that decades of criminalization has not worked. It has contributed to the shaming, marginalizing, and deaths of thousands of promising, caring, and much-loved individuals. It's time to move drug use away from a law enforcement model to a health-centered model. Those who have lost a cherished family member to drug use will tell you that criminalization and stigmatization caused far more harm than good. I'm proud of our province for taking this vitally important step and seeking an exemption to the harmful impacts of Canada's drug laws. The goal of decriminalization is to reduce suffering and death. It is a critical component of a range of meaningful, evidence-based responses to substance use. It is a compassionate and rational response to a health crisis. And now I'd like to introduce Mike Knott to speak.
Good afternoon. My name is Mike Knott. I have worked on the front lines of the overdose crisis for a number of years. I'm not here on behalf of either of the organizations I work with. I'm just here independently, showing some support and solidarity for what the government is doing here. I was a serious substance user for many years myself. I was criminalized, and as was shared, I hid my drug use, and from shame, from stigma, from criminalization, hid my drug use as much as was possible. And I count myself as very lucky to be alive during these times. I work daily with many people that still suffer with addiction, families that still suffer with addiction. And like what was already mentioned, there's no easy answers here. There's no easy magic bullet. There's no one answer to slowing the tide of these horrible deaths. But this is a great start. This is a little crack of light in some very dark times. That's the way that I feel. So I'm very honored to be here, and I think it's a historic day. I think we still have lots of work to do, but I think it's a great beginning. Thank you. And I would like to introduce Senator Larry Campbell. Thank you.
Thank you very much. I'd like to thank the Minister for inviting me here today. And I'm honored to be here with Dr. Henry and Mike Knott and Chief Coroner Lapointe. If the intention of a prohibition-based system was to protect individuals from harms inherent to substance use, then this policy approach has significantly failed to achieve this goal as an individual or at an individual or population level. Evidence shows that this approach has had the opposite effect and has substantially increased harms. Dr. Bonnie Henry, Provincial Health Officer, Stopping the Harm, Decriminalization of People Who Use Drugs. It's no coincidence that there's a former coroner here and the chief coroner for this province. This is about keeping people alive. That's it. That's the bottom line. I'm proud that our province is leading in this. This is open to any jurisdiction in Canada, and I would invite them to join in on this. And I'm confident that the federal government will respond favorably. It's important that we keep people alive, because that then gives us the opportunity to have an interchange with them on stabilization, on what is needed, on their mental health, their housing, their poverty levels, the racial components of this. And I remember when I was mayor that they were asking me why I wanted this supervised injection site. I wanted it just to keep people alive, just to give us a chance to try and help them. I think that along with supervised injection sites, needle exchanges, naloxone, these are all tools in the box that we need to fight this disease. And it drives me crazy that people cannot get through their heads that this is a health issue. Plain and simple, a health issue. And yet we continually make it criminal. We continually marginalize the people who are using this medication, if I can say that. And it continually amazes me that somehow the public in general are with us. We know by the numbers that they want this, but it's us, it's government that needs to take the responsibility. It's government that needs to move forward. It's government that has to save lives. And so I'm incredibly proud of this. This is not an easy step for a government to take at all. And so for this government to step forward, in addition to all of the steps that they've been taking, I mean, this isn't just a little bump in the road here. This is a long continuum that the government is following to address the needs of these people. I'll finish with this. I have never met a single person who's using substances tell me that they woke up one day then decided that this is what they wanted to do with their lives. That's not how it goes. This is a medical problem. This is an illness. We need to treat it. We cannot stand by and watch the number of people that we have dying when we could be doing something. Thank you.
Thank you to all our speakers. I'm very grateful for you joining, lending your perspective, sharing your insights, and bringing your voices to this important step. We will now take questions from the media.
Thank you very much. A reminder to reporters on the line, please press *1 to enter the queue. You will be limited to one question and one follow-up. Our first question goes to Andrea Wu, Globe and Mail. Andrea, please go ahead.
Hi there. In its submission, the province talks about the harms experienced by people who use drugs when interacting with law enforcement. So, for example, that harassment or fear of arrest can drive people away from accessing life-saving services, and that drug seizures can result in a person committing petty crimes or engaging in risky sex work to replace those drugs. If this proposal is approved, how do we ensure that these negative interactions, drug seizures, for example, don't continue off the books? What mechanism of accountability would there be?
I'm grateful to the members of the core planning table to have representation from across the province, from municipal partners, from people with lived and living experience, from 3 different police organizations, academics, to have them come together and to say, for example, that confiscation, seizing of drugs is something that they wanted to see specified in our application. That even if police are not pressing personal possession charges in some jurisdictions, that the removal of drugs is something that makes vulnerable people more vulnerable, potentially more vulnerable to overdose or to some of the public safety impacts associated with the illegal drug trade. So that it's been named in our application to Health Canada, I think, is an important step. And something that we've certainly identified as part of the education of police, something that is part of the implementation period where we get ready for decriminalization, and something that then is also included in the monitoring and evaluation framework that we've also requested be associated with a successful application. I'm speaking in this way, presuming that the federal government is going to say yes, that they're going to recognize the urgency of the situation, and that they are going to provide Canada's first Section 56 exemption to remove the criminalization of people who use drugs, and that they'll work with us on an urgent basis. And as well, that we as a province have committed to continuing to work with the core planning table, because there are a lot of outstanding questions still, and surely feedback that Health Canada will give us that we'll need to continue to talk with people who use drugs, and with police and with the social justice organizations that have helped us build our application.
Andrea, do you have a follow-up?
I do. Thank you for that. While decriminalization is widely seen as an important piece in reducing the harms associated with drug use and addiction, it doesn't address the toxic drug supply that is driving the crisis that we're currently in. For both the Minister and Dr. Henry, I'm wondering if you personally support a Compassion Club model for safe supply, and whether BC would ever explore the possibility of a cooperative buyers club type model that has been proposed by both the BC Centre on Substance Use and the Grassroots Drug User Liberation Front.
So another British Columbia first in tackling the overdose crisis and trying to save lives, especially during this period of COVID, where drug toxicity has become even worse than it was before. March 2020, we stood up a prescribed safe supply program just 2 weeks into the pandemic. Since that was introduced, we've had a 475% increase in uptake, the number of people that are connected with care. And I'm grateful to the nurse practitioners and the doctors in all corners of the province, but particularly in Vancouver and Vancouver that have piloted this, or that were kind of out in front, the pioneers working in this field. We heard from both the medical community and from people who use drugs that the program was too limited for them, both in physical access, but also in the types of drugs that were offered. And so in July, we announced an expansion of that prescribed safe supply program. I was pleased to announce that with Dr. Bonnie Henry. And that is now being implemented in every health authority. Already, we've added a couple of new medications, both Fentora and fentanyl patches now can be prescribed for the purpose of reducing overdose risk in people who have opioid use disorder. That's just one example of the new medications that are now available for safe supply under our prescription model, which is the ability which is the tool that our provincial has, the tool that our provincial government has now under a federal framework.
Yeah, thank you for that question. I think there's a lot of complexities to everything that we're dealing with. The short answer from my perspective as the PHO is yes, of course. There's a place for a Compassion Club model for to address the needs of certain population of people who use drugs. But I think there's more than one aim to decriminalization of people who use drugs. We talk a lot about stigma, about using alone. And what we have seen, particularly through this pandemic, is a dramatic increase in numbers of mostly younger men between the ages of 30 and 59 who are dying alone at home using drugs. And it is because of a whole bunch of factors that have led people who may not have used for a long time or may usually use with other people to be alone at home doing this. And part of the reason why they are alone is because of the stigma and the shame associated with using drugs. And that is directly related to criminalization. So decriminalization of people who use drugs covers a number of different areas, but it addresses people who are in the criminal justice system in that cycle right now, who are often street involved in their shelters, and who have the need for things like a safer supply. But it also addresses and takes away some of those, the impetus for people to hide their drug use, to be able to have those conversations, those difficult conversations with family, with friends, with their healthcare provider. So it helps us on both fronts. And I believe a Compassion Club model is a piece of the puzzle as well. And there are many other things we need to do. But those are this is a really important one step. It's not going to be the answer to everything, but it is an important step.
For the next question, we go to Binder Sajan, CTV. Binder, please go ahead.
Hi there. Just looking at some of the feedback to this, it's being applauded, but some advocates are saying to us that the recommended possession amount was dramatically cut at the last minute. Just wondering if you can address that and talk to some of the considerations around the possession amount.
Yeah, that is an area where there's ongoing discussions. You may have heard as well from some groups that they felt that it's a cumulative number that is too low. The number itself, 4.5 grams, is one that was a middle ground amongst many different voices. You will also hear from our public safety colleagues that they believe that 4.5 grams is too high as a start for this program. So obviously there is a lot of work we need to do to bridge that gap, to come together and actually address what are the concerns that people have. How does that play out in reality? So this is right now a theoretical construct, but it's going to play out differently in different parts of the province. And as the minister was talking about, we have a table that is committed to working on what does it mean in every part of this province. How are we going to address if somebody has this much of one thing and that much of another, and the very real practical reality that people are using more than one substance. And we see that in the coroner's reports every month, sadly. So there's a bunch of different issues. This is a start. And this is a start where we've said that here's a place that we can work from and we can try and address over the next the coming months and weeks as we move ahead with this. And I don't know if you want to add to that next.
So the core planning table that provided the advice, the evidence, and the recommendations upon which I built my final submission of the application was built on evidence. We knew going into it that we wanted to decriminalize the most number of people that use drugs, to make sure that and we heard that too low a threshold could have the effect of de facto recriminalizing people, because we've been in this place for a little while where personal possession charges have not been laid. So that was certainly strong encouragement that we got from the many members of the core planning table. We also took their advice that the threshold identified be a floor and not a ceiling. And so police have discretion if they see that even if somebody is carrying more than 4.5 grams, but there is no evidence of trafficking and there's a good argument for it being personal possession, that is within police's ability. And the 4.5 was set based on evidence that was provided about what the experience of carry levels was from people who use drugs. We certainly identified in the Health Canada application that the question of polysubstance users would be above that 4.5 threshold, and it's something that we need to attend to. But more than anything, important for us to be able to let Health Canada know that the threshold that we chose was based on evidence, and some of the lower proposed thresholds that have been out there, we asked for an evidentiary basis on and did not hear that. And so I'm proud to stand behind the application that we have and know that the next step will be hearing back from Health Canada and starting to work through some of the issues that we identified in our application that need more work.
Binder, do you have a follow-up?
I do. Just wondering, just first of all, how long you think it would take to potentially hear back from Health Canada? And also, as you mentioned there, that's kind of not charging for simple possession is something that police officers in different parts of BC have been doing. So how different will life be if this is approved by Health Canada compared to now?
Mm-hmm. Yeah. I am, first of all, very encouraged that the federal government has followed British Columbia's lead and created a Ministry of Mental Health and Addictions. British Columbia's ministry was the first in Canada, led by my friend and predecessor, Judy Darcy. And I worked with Minister Carolyn Bennett when we both were members of Parliament in Ottawa, and I'm looking forward to working with her. I really hope this is the first item on her desk. We are in British Columbia have felt the urgency of the toxic drug crisis for 5 years now and more. I know lives were lost before that. But this is certainly something that has hit all across Canada, and spikes in overdose deaths due to the pandemic have been experienced in every province. So I feel confident that the federal government shares the urgency that we are feeling here in British Columbia. And I don't know how quickly it will come. The response will come just because of the interregnum period. We haven't been able to have those back and forth conversations. Although I've been talking with former Minister Patty Hajdu over the past year about what an application would look like. We certainly want to see consistency across the entire province. And so the de facto decriminalization that I think some people who use drugs have experienced has not been consistent. And that's been a very important part of the Premier's instruction to me when he built this into my mandate letter is we want to have all people who use drugs across the province have the same access to justice and the same access to healthcare.
For the next question, we go to Lisa Cordasco, Vancouver Sun. Lisa, please go ahead.
Thank you. I wanted to pick up on that point about BC has implemented decriminalization as a matter of policy for at least a year now without reducing any overdose deaths. So why do you expect that doing the same thing with the federal government will produce a different result?
We've continued to hear strongly from people who use drugs that interactions with police, that confiscation of their drugs is it puts them in less safe situations, both from an overdose perspective, but also from a personal safety perspective. We understand also that we do not, in fact, remove the true stigma until we remove, in reality, the criminal sanctions. This continues to be a strong call from people who use drugs, strong call from public health. And although we've done what we can in British Columbia, we believe with the tools that we have, the step that was recommended by Dr. Henry in 2019, the ideal was a federal application. And with this application today, we've achieved that. So confiscation, true stigma, and having equal access across the province are the three pieces. And as well, to have police just have an absolutely clear instruction and direction that trafficking remains illegal, that we want them to focus on drug dealers and on the true crime, and we can more completely invite people into the healthcare system without any fear of criminal sanctions or penalty or any intimidation.
Lisa, do you have a follow-up?
Yes, just a couple of details about the application. Does this include youth who are found with illicit drugs? And if I could ask Senator Campbell why he believes that the federal government will say yes to this proposal.
That was two questions in one. That's a good one. We're all ears, though. Thank you, Lisa, for the question. So our framework, as specified in our application to Health Canada, proposes that decriminalization at this time apply to adults 19 and older. We are all alarmed and heartbroken when young people fall to the toxic drug crisis. And as a province, building in youth treatment beds, building new foundry centers, adding integrated child and youth teams, trying to tackle from inside our existing powers, ways to interfere, to interrupt the attachment to the increasingly toxic drug supply for young people is, of course, a priority as well. But youth federally are dealt with through the Federal Youth Criminal Justice Act and not through the Controlled Drugs and Substances Act, not through the Criminal Code. Apologies. And so we've identified this as something that we need to work out with the federal government. But how this would work, and we certainly heard this from parents and from police, it just makes all the sense in the world to say that a young person at age 19 could drink beer or could be covered in our proposed decriminalization of illicit drugs framework. And so we'll have a consistent age and also have flagged this as a area that needs further conversation with the federal government.
Thank you for the question. I'm confident that they will okay this because the minister, Minister Hajdu, has for the last, while she was Minister of Health, has been continually taking steps under the various legislative options that they have to make a difference here. And I think that I expect that this will continue with Minister Bennett, who's a doctor and who has incredible experience within this area. And so I would find it difficult to find the federal government simply shrugging their shoulders and saying it's okay for 1,500 people to die a year in this province. I don't think that that's what they'll do. So I think that it's a complicated issue. It's two jurisdictions, and we always know when two jurisdictions get together that sometimes it takes a little bit longer for everybody come to a consensus. But I believe that this is life and death. This is there's nothing more important. So that's my answer. Thank you for the question.
For the next question, we go to Moira Whiten of the Tyee. Moira, please go ahead.
Hi, thank you very much for taking my question. Following up on some questions from my colleagues earlier, given the concerns that the cumulative threshold is too low, and also the fact that consumption patterns and amounts change as the drug supply fluctuates very rather violently in quite a short amount of time. Can this proposal meaningfully decriminalize people for the next 1 to 5 years, as in the submission you say you will need to evaluate? And, you know, to Minister Malcolmson, will your government follow the path to decriminalization provincially that Dr. Henry laid out in 2019 if Ottawa denies this application?
So starting with your last question first, the Premier in my mandate letter asked me to pursue decriminalization of people who use drugs as a way to interrupt the impacts of the toxic drug supply and to, along with all the other actions that we're taking, to work to end the public health emergency. And he specified a Section 56 exemption, as did Dr. Henry's 2019 report. And the mandate letter also specified a made in BC solution if the federal government doesn't say yes. So this is a federal exemption because this is federal legislation is absolutely the clear path to go towards, and that's what we're pursuing. And I share Senator Campbell's optimism that the federal government will look favorably on this, but also will act urgently. And so we'll continue regardless to assert as a provincial government that drug use is a public health care matter and not a criminal justice matter, and continue to use whatever tools we can provincially in the absence of federal leadership. The call for decriminalization has been long-standing, and I do want to acknowledge the people with lived and living experience and the very powerful arguments made over time by some very effective British Columbia advocacy organizations that have called for decriminalization. This is a long-standing call to action that I'm very proud that today our government is stepping forward and acting on. We'll continue to get the advice from people on the ground, on the front line of the overdose crisis, and those in public health care about the best way to implement this, and continue to measure and learn as we go. This is the first province in Canada to take this step. And so we have to hear from continue to hear from all partners, and continue to modify our approach as we gain some experience and learn as we go. We have built into our application a robust evaluation and monitoring framework. We want this to work. We want this to save lives. We want this to remove barriers to accessing the public healthcare system. We want this to stop people using dangerous drugs alone and dying alone. And that will be our measure, and that's our commitment as a government.
Moira, do you have a follow-up?
I do, thank you. Minister Malcolmson, you have said that you will bring back Bill 22 from last summer with more consultation in order to expand the province's powers to involuntarily detain youth who overdose under the Mental Health Act. Advocacy organizations and Indigenous leaders and organizations have said this will increase youth's likelihood of experiencing further trauma or overdosing upon release without proper care and support. You acknowledge in this submission today that mandatory treatment or detention is not the best solution for supporting adults who use substances. So why are you trying to expand the healthcare system's power to do so for youth?
The work that was started by my predecessor, Judy Darcy, and that I'm continuing is more narrow than what you described. Moira, it is stabilization care, very short-term stabilization care for a youth immediately following an overdose incident, so that we don't have the phenomenon of youth being in an emergency room, and as some nurses have described to me, them stepping off the gurney, having regained consciousness, and walking barefoot into the night. Those are heartbreaking stories. We have, at the same time, a lot of work to do inside our public healthcare system to get the racism out. That's our government's commitment through the report that we commissioned called Now in Plain Sight, the work that we commissioned from Mary Ellen Trappell-Lapointe. And we have got more work to do to make sure that our care that we offer in hospitals is culturally safe and trauma-informed. I recognize we're asking a lot of our public healthcare system right now, fighting 2 public health emergencies, unfolding the largest ever vaccination program, and everybody is tired. That said, we're asking public health to do more. And the stabilization care, short-term stabilization care, was identified in the legislation last summer, was for the intent of allowing short-term stabilization and the opportunity to connect to services. That's why we've been focused this past year on building up voluntary youth addiction treatment and recovery services, more harm reduction. And that conversation is going to carry on as we build up both the voluntary system and consider the best way with all rights of young people observed and honored to give that stabilization after an overdose for the hope of saving more lives.
For the last question today, we come into the room. This question goes to Shannon Waters, BC Today. Shannon, please go ahead.
Hi, Minister. I'm curious about you mentioned earlier about your mandate letter and what it tasked you with in terms of trying to deal with decriminalization, and it uses the language prompt action from the federal government on this submission that you've now put forward. What's your definition of prompt action, and how long will you wait for Ottawa to do something before starting to move on a Made in BC solution as outlined in the letter?
Yeah, we are all feeling the urgency of the overdose crisis. We have got really good evidence that has been gathered by the members of our core planning table and the both people who use drugs and some of the academic organizations that supported that. This is the first time in Canada this has been proposed, and so I expect that both the federal government will look carefully at this, but also know that the time is urgent. And we'll continue to talk with the members of the core planning table about their optimism about how the federal government responds. We understand that there will be discussions that have to happen between the 2 levels of government. But in the meantime, we'll continue to do what we can as a province to assert that that stigma and shame around drug use is something that is preventing as a barrier to accessing public health services, and we'll continue to do what we can within our provincial powers to build up voluntary treatment supports and harm reduction to save lives.
Shannon, do you have a follow-up?
I do, and I was told I should take my mask off for it. Make it a little easier to hear.
Can I just say how nice it is to see a reporter in the room after a year and a half of virtual? So thank you for being here.
I'm going to try for a double-barreled one this time around. And so first of all, I'm curious, we're talking here about moving the issue of substance use into the public health realm, and yet there's quite a bit of emphasis on sort of law enforcement, their concerns about this move, and they've been consulted on it. And I'm wondering if you, Minister, and Dr. Henry as well, can speak to what it is that the province is looking for out of law enforcement and how those submissions are sort of valued given your sort of stated effort to move substance use away from law enforcement. And then Dr. Henry, I'm curious about your 2019 report and the submissions that you made, the suggestions you made for the province to make changes to provincial legislation to sort of realize some of these same goals, and why, like, you didn't mention sort of a federal approach in that, and I'm wondering what's changed and why now you're backing this submission rather than the action that you outlined back in 2019.
That the Canadian Association of Police Chiefs called for decriminalization, and many police forces have recognized that criminalization of people who use drugs has worsened the overdose crisis and has not helped. That was a very powerful message. And when I see how many people across Canada, and particularly people in British Columbia, are in support of decriminalization, the public opinion polling shows that. I think a lot of that has to do with the strong voice that police have made, that their call to action on this. I think it's fair to say that we knew when we created the core planning table that we were inviting very disparate interests and people that we wouldn't expect necessarily to have common cause, at least on the fine print of an application. But everything that I've heard from the members of the core planning table have said that the conversations, even when there was disagreement, that they were respectful, that they were constructive, that all the members really understood what was at stake. I imagine that if you interview police, that you'll find that they don't support the thresholds that are in our application. And yet I'm grateful that they remain for all the conversations, and a lot of the application represented full consensus of all the partners. And as well, implementation with police is going to be vital. We are going to be asking them when they do find somebody who is in possession of some of the 4 illicit drugs that are named in the application, that police will be offering them information and referrals about how to connect with healthcare in their community. And so the partnership, no matter what, is going to continue to be important. We are grateful for the advocacy and the relationship with police. And we are grateful for all of the members of the core planning table that gave a lot of time over this summer. Our most recent meeting was on Thursday, right up to the end. Everybody was working hard on this. And I hope that they'll continue to, because we'll need their advice once we get that next round of feedback from Health Canada. And I hope as we move towards implementation.
Thank you, and I will echo that. I had the privilege of meeting with a number of representatives from our public safety community on Friday to talk about some of the very specifics. And I think this is a conversation that we have had over many, many years, starting before my report. And it is an important one to have with public safety, and to have to address their very real concerns. And it is very varied across the province where different police detachments or police forces are at in terms of this issue. We know that the City of Vancouver has been addressing it in their own way, but that is very varied, whether it's an RCMP detachment, whether it's one of the 60 or so local police detachments. So there's a lot of work for us to do, but they are important, critical partners, and we have committed to addressing the concerns that they have. And the people on the front lines who've been dealing with people in the communities, it's going to be a change, and it's a change that needs to be supported, and all change is challenging, and we just need to find the ways to get through it. And I think I've been incredibly impressed by the commitment that we have from our public safety colleagues to be part of this table, even when it's difficult, even when it's hard and challenging. And I'm going to be there with them. And I think from my report, and I do want to say, of course, that my predecessor, Dr. Larry Campbell, has been a great mentor to me, and we've worked together on this for many, many years. And our initial mandate, or our initial recommendation, was that we do pursue a federal exemption. At that time, the federal government was not open to considering that. So the report was addressing that context. And thankfully, since the time of the report, that context has changed. And this is the best way of addressing it from a holistic point of view. And from a public health position, I hope that, as Senator Campbell said, that other jurisdictions in Canada will look to us for how to do this in the right way. So it is, it's a very challenging start, and but it is a start. And I think that's important, and I'm very grateful and proud that this government has stepped up to do that, and I'm here to support it in every way we can. Thank you very much.
Thank you very much to everyone on the line. Thank you very much to everyone here in the room. That concludes today's event.